ambulatory or home-based decongestion strategies may become intrinsically important in heart failure care. Hello, my name is Biegus. I am a cardiologist, heart failure specialist, and I work in Wrocław Medical University in Institute of Heart Diseases, Poland. And I would like to briefly summarize one of the trials that was presented lately in Barcelona during the HFA meeting. The SUBCUT HF trial randomized approximately 170 patients across 20 hospitals in UK to either early discharge strategy with subcutaneous furosemide pump, which was held by the patient and which was handled by the patients, and the patient need to replace the furosemide every 3 days by himself, or the caregiver do it, or to usual care. So the two strata of the trial was either early discharge strategy or usual care strategy. So, and the primary endpoint was the number of days alive and out of hospital at 30 days. So importantly, the early discharge group started with an inherent advantage because patients were discharged substantially earlier with a difference of approximately 5.5 days. The trial met its primary endpoint with a between group difference of 4 days favoring subcutaneous strategy, which was statistically significant, which means that patients who were discharged early with a medium of 2 to 3 days after the randomization with this subcutaneous furosemide spent less days in hospital compared to the patients who were treated as a usual care. Again, the difference, they started with a 5.5 days advantage, and at 30 days, the advantage was still 4 days. At the same time, the investigators showed the data about the risk of rehospitalization in both groups. And it is very important to interpret the rehospitalization data very carefully because of this unique, I would say, unique conduction of the trial. The risk of rehospitalization appears to be approximately 2 to 2.5 fold higher in early discharge group. However, this comparison is biased because patients who remained in hospital cannot, by definition, be rehospitalized. Therefore, the exposure time to rehospitalization was fundamentally different between the two study arms. Overall, this is a very interesting and clinically relevant proof of concept study, suggesting that ambulatory or home-based decongestion strategies may become intrinsically important in heart failure care. However, we still need to wait for the full publication to better understand the patient selection, safety details, quality of life or outcomes, and a full rehospitalization analysis. Thank you for your attention.